A.Heyda. So good morning, everybody, officially. I will be a little bit distracted letting more people in. Last timers, good morning. Welcome to the World Breathing Day. First, I would like to say why we're doing this World Breathing Day. And this World Breathing Day is dedicated to the International Day of the Breath, of course, because it is part of who we are and what we do, and because we're just alive. But we did do a lot of work as an International Breathwork Foundation around it to establish it through the UN as the Global Day of the Breath. So it's acknowledged as a breathing technique that helps all aspects of our being. So we're very thrilled about that, but it's really more than that. It's about being alive, celebrating life itself. It's much more than just an organization or a day dedicated because somebody said so or because we arranged it. It's about us being alive, being in the planet, offering what we are, who we are, what we do to the rest of the planet. So it's basically a celebration of life. And here comes A.Heyda. So I'm going to be present here. I'm very honored for it, along with Caroline here. And very happy to have you a co-host and be here and support what we will do today.
Thank you.
Griet in the background as the tech support, very, very important. Without her, I don't think I would be able to do that on my own or even support the rest of you. And right, we have like 44 people in the room at the moment. Welcome, everybody. So A.Heyda, first of all, lives in Poland and Warsaw, but she's available worldwide, and she will drop her details at the end of the session. So everybody can reach her if you decide that you want. And she is a psychotherapist and a clinical psychologist, psycho-oncologist, certified breathwork practitioner. She's been helping patients, cancer and mental health patients, but also now with COVID, to be able to integrate, reduce anxiety and phobias, depression and pain, mainly through breathwork, and of course, all her other skills. What she's going to present us today is the practical application of breathwork in the time of COVID through the application of the IBF, the Breathing App. And she's going to explain how this is actually beneficial and how you can apply it even at the time of COVID. So you can keep yourselves motivated, self-aware of your psychosomatic experience. So I'm going to be giving the platform to her, and welcome, A.Heyda.
Hi, everyone, in this beautiful Sunday morning. So what I would like to present today is just my experience with the wonderful and practical IBF Breathing App. And as a, let's say, very practical therapist, I have always been dreaming about such an app. So my dreams came true last year. And I will show you a little bit how it works and why is it so beneficial for everyone. Now we are after a long year spent in pandemic times, and everyone might be, of course, isolated, frustrated, anxious, or just numb. We may fall from being numb or frozen to being aggressive and back. So here we have such an important tool for our own self-regulation. Yeah? Let's say I work at the first line of medical war, so I'm meeting the patients every day at the hospital and my private practice in southern Poland, Gliwice. So I may get a little scientific, during my presentation, but I will answer all your questions. Yes, and there is no dumb question, okay? I will welcome every question, even about my favorites, let's say rainbow unicorns or whatever you think or would like to ask. So everything is okay. And now I will present you a little bit of my work while I've been using IBF Breathing App, and I am using it daily, okay? simple, let's say normal people who are not hippies, yogis, breath workers, I don't know, chakra seekers, may really benefit from this wonderful, simple tool. Now I would like to share the screen. Okay. So most of you probably know what Breathing App is, but maybe new people who will be watching it later or they are watching it now, they really should know. So we have wonderful creators of the Breathing App, Bridget Martin Powell, Judy G, Mario Domik from International Breathwork Foundation. You can download this app for free, and immediately you will see all the app features. You can set the session time from 2 to 45 minutes. We have 3 modes: relaxing, where the exhale is a little bit longer than the inhale. That really means that you are suggesting to your nervous system to calm down. Yes, for our sympathetic nervous system is reacting to the longer exhale with 6 breaths per minute. Energizing style, that also might be very beneficial, where your exhale is shorter than your inhale, that activates your sympathetic nervous system, and also might be useful instead of, let's say, the 5th coffee, in case you're exhausted and a little bit filled with brain fog. And the balancing mode, which is always beneficial, and I use it most often, where the inhale time is the same as exhale time, with 6 breaths per minute. People optionally may turn on the background sound. My patients really like the ocean waves or the birds which are there when somebody would like to breathe and would like to close their eyes. You can turn on, they can turn on the breath sound, suggesting when to inhale and when to exhale. So you see, it looks very, very simple. Here, together with a little ball, we take the inhale and we take the exhale. And on the inhale, the little ball is flowing up. And with the exhale, the ball is flowing down. And this inhale is long enough to have a long inhale from the bottom to the top, as if you were filling yourself up like the vase with water. Yeah, from the bottom to the top, belly, chest, and exhale. This is the vagus nerve, the 10th cranial nerve, which is activated and stimulated during the breathwork practice. You see why I'm showing you all these anatomic pictures. Vagus nerve innervates almost all organs, starting from the brain, orofacial area, neck, and heart, and all vital organs. So whatever you are doing with vagus nerve, you are simply hacking into your psychosomatic system. And research is clearly showing that it works. Okay. Vagal activity. It is about it is just about how your heart is beating, because vagal activity is measured by the two features of how our physiology works. So it's respiratory sinus arrhythmia, and heart rate variability. And vagal tone is reflected by them. So when you are healthy and fit, when you are doing an inhale, your heart is beating a little faster. When you are doing an exhale, your heart is beating a bit slower. So at the little picture here, you may see how the breathing is reflected by the heart rate. Yeah. And if respiratory sinus arrhythmia and heart rate variability, if they are flat, that means that a person is not in a very good shape. So flat curve here, yes, flat wave is clearly related to depression, anxiety disorders, behavioral disorders, attachment disorders, post-traumatic stress disorders, or any complex traumas. It's related to increased mortality in cardiovascular diseases, diabetes, some cancers, and other diseases. So what we see here is a certain picture. Vagal activity is a certain picture. How are we doing? And if we do slow-paced breathing, 6 breaths per minute, that clearly increases heart rate variability and respiratory sinus arrhythmia. If you have, for example, Fitbit, you may clearly see how your heart rate variability changes while you are doing 6 breaths per minute. You can check it out yourself. And that happens, and also it increases the sensitivity of baroreceptors of the healthy and clinical groups. That means that you are affecting your blood tension. And if slow-paced breathing is trained at least 15 minutes a day, it reduces hypertension up to 10 points in both dimensions and gives maximum circulatory and respiratory efficiency, including oxygenation and much more. There are a lot of, let's say, cardiovascular factors that are clearly improving after switching to 6 breaths per minute. This type of slow rhythmic breathing was tested among people who had heart operations, who had heavy diabetes, very high hypertension and obesity, and everywhere this type of breathing is clearly improving the shape, psychosomatic state of everyone. Yeah. And what's interesting, in one experiment, the Bernardi team gave oxygen to one of these groups who were training slow-paced breathing, and adding oxygen didn't make things any better. It was even a bit worse. So we are really benefiting just from breathing with normal air. Of course, if someone needs oxygen, this person needs oxygen, but in the normal functioning, we do not need any addition. We need our awareness and breath to quickly get better. I would refer a bit to Polyvagal Theory by Professor Stephen Porges. Probably all of you know a little bit about it. So 6 breaths per minute is an easy rhythm for the beginners for starting any breathwork experience. And it's very useful in non-clinical groups and probably in almost every situation when conscious breathing is possible. So I have been using 6 breaths per minute or any other useful breathwork techniques even in intensive therapy setting, or while someone was in a very, very bad shape. So here we are setting healthy vagal tone, moving from the freeze system, like Stephen Porges wrote, when we are very exhausted and traumatized, we are behaving like a mammal struck by the car. We are frozen numb and we are not moving. So this is this freeze part, and this dorsal part of parasympathetic nervous system is dominating. So in this state, you cannot just do the relaxation. You need to move out and unfreeze through the sympathetic mobilization. So here is another state of activity of our nervous system activity. It's fight or flight state, where sympathetic system nervous system is working and we are able to defend ourselves or to run away or to react actively, let's say in normal life, where we do not have, let's say, any mammals who are chasing us, who is chasing us. And while we are controlling the vagus nerve activity, we can move towards social engagement system. This is this moment when the mammal feels active contentment. This is the safe green zone and activation of parasympathetic ventral vagal part. So in this green zone, we are in connection, we are related to the group, we are able to reach out for help, for support, to feel love and bond. So this simple 6 breaths per minute method may really help us to move from the freeze. This is polyvagal chart, and here you can clearly see that there is a long way from freeze to social engagement. Yeah, and by regulating our vagal activity through breath work, we just move towards the green zone. We are telling our body now it's okay. And my experience is that when someone is heavily traumatized, it of course takes a little time and several sessions, but it surely works. We may go back to this chart later if there are any questions. So I'm thinking about now describing you a little bit of my work at the hospital. When the pandemic started, of course, the hospital was well taken care of. Patients were tested, but sometimes when someone is freshly infected, the test will not show it. So we had the about 50 years old patient hospitalized to receive radical radiotherapy treatment. And we found out he has contracted COVID. He was immediately isolated from the other patients. And in a couple of days, he had high fever. He developed severe pneumonia, received antibiotics, anti-inflammatory drugs, and analgesics. And he was using an oxygen concentrator and the mask, which has helped him through the day and night. And at that time, I was unable to enter the room, so I was just able to call him, to try to talk to him on the phone. And luckily, he was feeling well enough to talk to me. Very exhausted, he said he's breathless, but still he was calm and able to focus a little bit. So the worst symptom he has complained about was horrible coughing that made him unable to rest and to use fully the inhalator because anti-inflammatory drugs were administered mainly through this inhalator, and they were helping him. So he agreed to download the app, and he followed my verbal instructions, and we did 5 minutes, seeing how it works. And he felt immediately a little bit better, although it was distracted a few times by coughing. But he had this quite new relaxed state of mind after these days of exhaustion and stress. And he trained daily, several times a day for a couple of minutes, and it helped him to breathe better. Several days ago, he reported that he's breathing easily in general. He's getting better. His pneumonia was able to be treated medically. But this type of exercise has helped him to go through the inhalations without coughing and to rest. And he said it really minimized his coughing. So I think this little small intervention brought a lot of benefit here and supported the whole medical efforts to get him out of this. And he's doing fine, okay? He's okay. He could have his own treatment later. Like I said, I'm using this little application daily, and just normal people who are not experienced in any type of therapy of yoga or breath work are somehow open to this little smartphone experience. Application is helping them to keep the exercise going without falling asleep too quickly or to get distracted. So it's a fantastic tool to keep them going. Okay, I was in constant contact with a 65-year-old female patient. She was treated for oral cavity cancer. You know, that means that she had horrible, complicated surgery, saving her, and later on it was followed by chemotherapy and later by radiotherapy. So you may imagine it's several months of stress, strain, probably anxiety and heavy treatment. And between the surgery and first course of chemotherapy, she had COVID-19. And she said she really feels breathless, stressed, and tired. We breathe together using the applications. I have showed her how to fill herself up from the bottom, from the belly to the top of her lungs, without pushing too much to the chest. Yes, most people with whom I'm working, they are unable to move their belly properly. So it always may take a little time if you have an ordinary person without any yoga experience or sport experience. And after this 15 minutes real balance mode exercise, she felt instant relief and ease, and she stopped to be afraid to fill her lungs fully. People who are going through COVID-19, they're often afraid to take the whole deep breath because they are coughing and it hurts. So here we worked through this, and she repeated this exercise daily, and it truly amazed me because her motivation was stunning. After the first contact, and after 3 days, she reported better breathing and mood improvement despite very serious prognosis. She continued to share the application with the closest family and friends. Those who had COVID-19 followed and used the app reporting ease and calm. She received the feedback that keeping IBF app breathing rhythm has helped her family members to cope and not to panic after very, very stressful news about the death of the relative. So the cousin of my patient turned on the app and she continued breathing because she didn't want to panic or to have a meltdown after this news. She of course continued the experience, and that helped her to cope with the stress of loss and later with grief. I am meeting also patients who do not have cancer. And here is a little story of my 26-year-old patient. She's treated for depression and eating disorders. She's doing fantastically at the moment. And she assisted, and she stayed by the side of her elderly grandfather. He wasn't admitted to the hospital. There wasn't. Doctors decided that they could not do much for him as he had advanced Alzheimer's and heavy pneumonia, and he was dying at home, having oxygen and morphine and being taken care of. And other members of the family at that time were very distressed and shaken. And she was able to stay by his side till the end. She has helped him to stay calm in this extreme experience. And she used application to self-regulate. She regulated her own breathing, and the grandfather semi-consciously followed her breathing, because we as mammals, we adjust to each other. So they were both doing fine in this heavy experience of dying. And here you may see how her own abilities to self-regulate increased significantly due to keeping the healing breathing pattern. And she was sad, of course, and she was a bit distressed by how the other family members are feeling, but she was doing fantastically, especially when we take into account the long-term depression and her own exhaustion. So you may use the application not only to, let's say, oxygenate yourself. You may use an application to self-regulate, to stay in a green zone of social engagement without being cut off, put into the trance, depersonalized, numb, or attacking or aggressive. Okay. The fourth case, this is my current patient. She, of course, I have many patients at the clinic. I am working with her daily. She is an elderly patient with throat cancer, and she do not have the half of her right lung. She has survived different cancer many years ago, and now she is anemic. She's undergoing difficult treatment. This is radiochemotherapy. And she had recently had COVID before admitting to our cancer center. So while we were talking about her stress levels and how she's doing, she has reflected that after the COVID-19, she's not really well, but she was coping with a certain breathlessness or asthma symptoms after the first cancer. But now she's both weak and distressed. She had trouble falling asleep and sleeping through the night. She was constantly, of course, worrying about the future. She was distressed and she had trouble concentrating. And we decided that we could try breathwork together. So after, let's say, easy and nice instruction, while I was working on her breathing, I wanted to see if she is able to fill her belly and chest fully and gently. We moved on with an application, and she, after the first 15-minute session, she reported instant easiness, and that amazed her. And she slept through the whole night. So she kept the breathwork training during last 2 weeks. And despite being exhausted and having anemia, she felt very, very well comparing to the state she was in before. On Thursday, 3 days ago, we had a 15-minute session and we took pulse oximeter. And you may see how she was instantly better oxygenated after 15-minute session. And we remember here that she has anemia, and she is breathless due to lack of half of her lung, and she's having a very heavy treatment, and she's an elderly person. And here we are. She improved 4%. That's a lot. You may check on yourself how you're improving while breathing for 15 minutes, and see on your own pulse oximeter. It's quite a popular little feature. People have it. Yeah. So summing up my little case series, IBF Breathing App has proved to be easy to use by the patients, people not familiar with any psychosomatic training or therapy or sport. It's very easy to use in hospital conditions. We only need the patient to have a smartphone. And if a patient does not have a smartphone, I have it, and the patient trains with me. That supports coping and psychosomatic regulation, state of connection and calm, reduces breathlessness instantly, and it's able to increase temporary oxygenation. Of course, it depends on how sick someone is, how ill someone is. It may vary, and the ability to keep focused for 15 minutes at least, it's a question if someone can do it or not. So I sometimes start just from 5 minutes, little steps. Every little step is a progress. When patient feels a little bit better, that's a success. A little breathes a little more deeply and calmly, that's a success. Breathes for 2 minutes with an application, that's a success. So we are moving here by baby steps. Yeah. And I think it will be, I've been talking for half an hour, but I believe you might have questions, and I will answer them. Maybe, okay.
Alicia, one is already in the chat room. Perhaps you can find it.
Sorry?
One question is in the chat room. What is recommended? When should we use balance mode, energizing and calming?
Okay. I'm trying to, when I am sharing the presentation, I do not see the chat window.
It's okay.
Okay, I just would like to move to the full screen, but I don't know how.
Okay, perhaps we can ask everybody to write their questions right now at
Here I am.
box. So
yes,
because we're coming to.
Yes, I will take a look at the chat box.
Yeah. No, I'm saying I'm inviting everybody to start writing the questions. So that's what I'm doing if they have some. Yeah.
Yeah.
Will you allow me to ask a question, please?
Yeah.
Yes. I have a patient who have chronic lymphocytic leukemia, stage 0. It's still in the early beginning with very high, with high lymphocytes and high white BCs. How can I help the, preventing the disease to progress?
Oh, that's...
Or how can I help him to maybe to improve his case, please?
Okay. There's no such research that clearly shows the impact of breath work on hematological diseases, and that's complicated. But I do think, and my experience with the bone marrow transplant patients shows that any self-regulation practice that the patient is able to do during, chemotherapy and transplantation is useful. So whatever a patient is able to do would be very beneficial. If this person is open to train with a breathing app, regulating vagal tone, that's wonderful, and that's always beneficial. I would avoid any fast and confronting and cathartic methods in this state of health. Yeah, that's my idea about leukemia.
What kind of breathing do you recommend? Is it the
I would recommend relaxing or balance mode on the application.
Mhm.
And of course, mindfulness, basic mind and breath observation will always help the patient to calm down. And if the patient is able to train 6 breaths per minute, he or she will have less symptoms during chemotherapy. That's my experience. You do not have such deep nausea,
Yeah.
or let's say anxiety, somatic anxiety, and the appetite will be better. So anything that this patient is able to do, because I am aware how hard is chemotherapy for leukemia. So,
Okay,
so I would not push. Yeah, I would not push towards anything that patient decides that it's good for him. So, starting for 5 minutes of breathing up, moving to 15, taking a look at John Kabat-Zinn exercises of mindfulness. Yeah, thanks. Okay, I'm looking at the.
Yeah, we've got from Priyanka and Flores at the Family Center questions. The first is, can you recommend how do you use it with a child age 13 with pain and anxiety for an injury, who is often in anxiety in general about whether she will heal?
Okay.
And I'll tell you the next one after.
All right. So let's focus on the kid. Children are breathing a little faster than us, and I'm not sure if she's tall enough. Let's say her lungs and her body is tall enough to handle 6 breaths per minute. But the experience of other breath workers from New York, Patricia Gerberg and Dr. Brown, these two medical doctors trained breathwork with children in Rwanda and in Thailand after a tsunami case. Remember, it was horrible. And they said that children are breathing twice as fast as grown-ups. And they were able to self-regulate without any verbal therapy while they were training with their mothers. So my suggestion is to engage mother. So the mother should be training. I would do this like this. Mother should be able to focus on balanced mode of breathing, or but because relaxed has such a long exhale. So on the balanced mode breathing, and just to check how the child is able to follow. And probably, I think if the child is not tall enough, yes, it's the child, I would switch to a little faster mode, like 8 breaths per minute, for example, 4 seconds inhale, 4 seconds exhale, just to try, okay, to calm the child down. But the main thing here is to mobilize the mother to self-regulate. It's a mother I would focus on. I'm not working with children alone, never. Mother and father, of course. Yeah. So, or anyone from the family or the caretaker who loves the child. So we are starting from the grown-up who must be able to self-regulate. And then if the child will be held tight and held with love and touched, if it's possible, if the child's attachment style enables her to, let's say, tolerate the touch, because we don't know anything. So the more love and touch and self-regulations from the grown-up and the loving parent or caretaker comes to the child, the more she is able to self-regulate and feel better. So I would work with family and see how it turns out. Yeah.
Okay, shall we move to the next question?
Yes, please.
Priyanka, what is recommended when should we use the balanced mode, energizing and calming, and how often is it recommended? What amount of time should we select on the app?
Okay. It depends on your state of health. So I always start from the balance mode. It's quite well researched. I have cited this research on my presentation because it truly gives you activation and relaxation at once without being, let's say, too relaxed or numb. My observation is that too much relaxation is not a good thing. Firstly, if you are too much relaxed, I'm not referring to the breathing mode, but generally, too much relaxation gives you poor oxygenation, high lactate, demobilization. It's not very, very good, and it's totally not beneficial for example, cancer patients as a main practice. I'm just pretending to do relaxation to my patients. I may say, just feel your muscles, just let them go. And I switch to the different techniques, but it's not a pure relaxation. So I would switch to the balance mode. And if I would be overexcited, really nervous, really stressed by something, I would switch to the longer exhale if I need to instantly lower my blood tension. Yes, and my heartbeat. If you need to lower your heartbeat instantly, you need to slow down your breathing, even moving towards 4 breaths per minute. If you need instantly, if you need just to check how you would feel and you are not in the anxious, aggressive state, just see which one is better for you. For example, I have this experience with some of my clients and patients with a generally low blood pressure. They do prefer more intensive pranayama, more intensive breath training, and I would prefer it for myself too. As if you are, for example, experienced breath worker, you are just habituated, you got used to the slow breathing techniques, and to feel something deeper or to get in touch with something that is happening in you, sometimes this more intensive mode will be better. It's like a coffee. Just try to find out, do you need coffee or do you need, let's say, Melissa tea? Yeah. So you need to find on yourself. Okay. Or scared, yeah, by the tingling or the feeling of little dizziness. And as a breath worker, I always take a look if someone is pushing the exhale, in case if it's a mental health patient or a cancer patient in a difficult state. If someone is a healthy breath worker and the process of this person allows us to go further, every breath work that comes out spontaneously out of the body might be beneficial for that person during that moment. So carefully, after describing the practice, after describing how the subjective lack of carbon dioxide looks in the body, how it feels, every patient group may follow. And I would begin with mindfulness, with sticking to the thought that everything is passing by and everything is impermanent, and the thoughts are coming and going like clouds, and every destructive thought and every possible bad pattern that appears in their mind doesn't prove anything. And that led to a certain inner freedom. And I started from this sensation and moved toward breathwork, because they were ready for bodily sensations. People who are in mental health departments, these patients are afraid of their bodies. They are afraid of any sensations. They're afraid of their minds, afraid of their thoughts. Imagine this hell. So we are starting by accepting of what is happening in the body. Okay.
Wonderful. And Lydia has a very similar question too. So she's asking, she's working with mentally ill somatic people. So schizophrenia, for example, would you recommend this with these people?
If they have medication and they are under the doctor's care, I would start just like with bipolar people, bipolar patients, slowly by mindful moving, by feeling the body, by accepting bodily sensations. And I would try the slow mode of breathing for example, try 3 minutes and see how it is for the patient. My students from Polish Integrative Psychotherapy Institute, they have psychotic patients in their group, the mental health places, and they are practicing mindful techniques and all the mindfulness techniques with success, and a little bit of breath work and conscious movement. But slowly, gently, without any cathartic interventions. Okay.
Wonderful. Couldn't agree more. So, Janine, she's asking, oh, sorry, no, Miss Stephanie. Stephanie, can pregnant women use the app?
Okay. Generally, when you are over 6 months pregnant, you cannot breathe like that because the belly is interrupting. This type of breath work, I mean 6 breaths per minute, slow and gentle, might be a very nice exercise for a pregnant woman. And I would try a few minutes at the beginning and see feedback, always like this. Try a few minutes, see feedback. And I would begin with an interview, checking on if this pregnant woman does she have any type of panicking style of reacting? Is she having any vegetative neurotic symptoms in the past? Did she have any panic disorder? Is her thyroid working properly? We need to be careful. While women are pregnant, sometimes their thyroid, goes a little mad or is underreactive. So in case of overreactive thyroid, I would try very careful to work with a person, but this person needs to be under doctor's care, yeah, and midwife's care. So always we may try. That gives really nice oxygenation without hyperventilation, so it's not endangering anyone. So we try a few minutes and then see how it goes, how the person is feeling. Okay.
Thank you, Alicia. So now it's Janine. So would you recommend balanced breathing mode with high blood pressure?
Yes, research showed that this type of work, balance mode, is working on hypertension, and it is the best researched data we have. Patients should try, and if a patient is this nervous, hypertensive person, I would start from 5 minutes and check on the feedback. If someone has this anxious, aggressive mode of function typical for high hypertension, this person might be really shocked by this type of breath work and the effects of this breath work. So we start slowly and we are moving towards 15 minutes per day or more. Yeah.
Beautiful. So Priyanka is asking one more question. Does it matter if you're lying down or sitting down?
Yes,
when you do this work?
Yeah. Let's say we can get the best heart rate variability when we are lying with our knees on a 90 degrees angle. Yes, when we are on the chair, we are lying and the knees are here and calves are here. But most of my patients prefer to breathe in a half-seated position, especially when they are not very familiar with me and they feel non-comfortable lying on my therapy couch. So we are doing half-seated position, and when people have trouble breathing, they are spontaneously moving towards half-seated position because lungs are doing better. So you may choose, but if you need instant, let's say instant improvement of heart rate variability and vagal tone, it's a lying position with your calves in a 90 degrees angle. Yeah.
Great. So Janine is asking a clarification question. How about with someone with broken neck C5 and who has spinal cord injury?
This person needs to lie in a way that is supposed to lie to get better. Okay, so we are not moving anything. Okay, we are not moving anything. We are not suggesting anything outside of the doctor's and physiotherapist's advice. Okay, for example, for years I have been leading therapy groups for the breast cancer patients. And for example, when some of them were truly overweight, their neck was very short and they couldn't lie down just like that. They needed a pillow or half-seated position. So the patient needs to find the position that it's safe and easy. We cannot decide on that. Yeah.
All right, last question for now, unless there's some more coming, and we're going to take for the next 5 minutes any last questions. Is from Justa. What do you mean by catharsis breathing, and when it is recommended?
Oh, this is a large area of, let's say, knowledge and experience. A cathartic experience when someone is abstracting traumas, dissolving traumas, when the body is shaking. Because when we are abstracting traumas actively, we behave like the animal who is struck by the car or shot. The animal is shaking. So this type of experience appears during longer breathwork sessions, conscious connected breathing sessions, or like holotropic breathwork by Stan Grove, or many practices who are using mouth breathing, yes, and it's fast mouth breathing. The cathartic experience may appear. So I would not recommend going into this when you are alone and when you do not have the constant contact with your breathwork practitioner who is experienced in, let's say, dissolving trauma. Yeah, and when any practitioner, the psychotherapist or breathwork therapist, if this person is not experienced or is afraid of the trauma and catharsis and heavy emotional expression, this person is not a proper person to stay by the side of traumatized client, and the catharsis will not appear because the therapist is not ready. So this is a completely different area than balanced tone of breathing, 6 breaths per minute, when we are just increasing our vagal tone. That increases our survival, longevity, and helps our cardiovascular system to work perfectly. Thanks.
Okay, so I'm not seeing any more questions at the moment. I guess I'm going to give people a little bit of time just in case they want to ask something. But it has been, I want to say it has been awesome. All the information here and the participation and all the questions have been just amazing. Oh, Julie is just saying, what's the name of the app or link to download? I think it's higher up in the message thread.
Yes, yes, IBF. Just in your application shop at your smartphone, please find IBF Breathing App, and the little logo looking like a whirlwind appear. Yeah, like an inside of a washing machine. Search for it.
Yeah, and it's actually, the application link is up on the message of the threads here. So, and we have a lot of thank yous, of course, and I absolutely agree, it has been awesome. And Michaela, if I'm pronouncing it correctly, says, you said something about mouth breathing.
Mm-hmm.
I'm not sure what you mean, Michaela. Mouth breathing, please.
From your experience, can you share anything about mouth breathing, effects of mouth breathing in certain conditions, anything, just spontaneously?
Okay. I practice Wim Hof breathing daily, and there we use mouth breathing. And I'm an old breath worker, so it doesn't affect me too much. But if someone is less experienced, it will result in heavy tingling, a lot of dizziness, intensive sensations in the body. And this type of mobilization mobilizes sympathetic nervous system, and that leads to immunological reaction that helps you to beat the infection. So I truly recommend Wim Hof breathing research on YouTube. It's very nice cartoons about it. I really love it. How Wim Hof methods participants received endotoxin, and they should be very sick. But they did 4 rounds of mouth breathing with breath retention between, and they were all healthy. And their body produced a lot of adrenaline and interleukin number 10, and probably, I think, even more, and anti-inflammatory factors, probably cortisol too. So mouth breathing is a sort of weapon with which you may fight and mobilize yourself. For me, I really like this technique, and I'm training it for myself deeper and deeper. So it's like you cannot fight with a sword whole day long, but you may have a nice little training in the evening, you know, for example, for 20 minutes. And I recommend, if someone is interested, to research on Wim Hof method and gently try gently how it works for this person specifically. Yeah, thanks.
Great.